Hi, I'm Dr. Jaleen Sims, and I'm an OBGYN hospitalist at OB Hospitalist Group. I work at a hospital in Mississippi. I'm here to tell you about a life-saved story today that happened just a couple of months ago in my hospital. A patient was just under about 30 days postpartum after having an emergency cesarean delivery very early. She was about 27 weeks pregnant. Based on her description, because she delivered at another hospital, so it sounds like she had preeclampsia, which is high blood pressure in pregnancy, caused by the pregnancy, not necessarily chronic hypertension. And she also had bleeding that was caused by a placental abruption, meaning she had her placenta separating from the wall of the uterus. So that is considered an obstetric emergency. She had no immediate complications after her delivery. She went home just fine. And I'd say about 2 to 3 days prior to coming to the hospital, she had been having like right-sided lower chest pain, right-sided upper abdominal pain, and the pain really made it difficult for her to breathe deeply, but she didn't feel like she had difficulty moving air. And so she assumed it was trapped gas. She tried different types of home remedies and she tried to rest to see if it would get better, and nothing helped. So when the pain became unbearable, she rushed to the closest hospital, which is how she ended up at my hospital. Hers was about 10 to 15 minutes down the road, and she came to my emergency department in the OB emergency department. Her vital signs were unremarkable. Her oxygen levels, they were 97 to 100%, so pretty good, except there were a couple readings that were like 91 and 92, but they all fell between all the high levels. So sometimes when we see that, we think it's a possible error with like the readings. On the exam, her lungs were clear, but she did have pain with deep breathing. And she also had pain when I pressed in the area of her lower lung, kind of near her bra strap area. For the moment, I actually thought it may be a muscle spasm, but I really wanted to take a deep look and see what's really going on with her. So I ordered labs and tests that would tell us if there were issues with like her liver, her kidney, her heart, EKG, and everything turned out completely normal. And even though everything seemed to point to a muscular spasm, there was just something about her story and her exam that just raised an eyebrow for me. And so at that point, I said, you know what? Let me go ahead and take even a deeper look. So at that point, I knew that patients who are in the postpartum state, who have had C-sections in the past, they are at higher risk for blood clots. And so I felt like ruling out a blood clot was warranted. I did order a CT scan of her chest and her abdomen, and lo and behold, blood clots on both of her lungs, in the lower lung fields, and also in the right lung. There was an area of tissue that had lost its blood supply. So, of course, at that time, I admitted her to the hospital, started her on blood thinners, and planned for a hematology consult later in that morning. Now, this all took place between 1 and 3 o'clock in the early hours of the morning. So, of course, all of the private doctors and even the doctor that was on call that would have taken care of her because she didn't have a doctor at that hospital, they were away from the hospital and sometimes up to 30 minutes away. So this underscores the value of having an obstetrician in the hospital 24 hours a day to evaluate and manage emergency cases like these. Now, for this particular patient, one of the other things about this case that, really highlighted for me was that of course, we could have sent her home after her initial evaluation, but the fact that our team went the extra mile to dig a little deeper, it really resonated with her. And it led to her heartfelt words to us. She said, "Thank you for listening to me." And this meant so much to our team because there are so many cases that you hear about with suboptimal outcomes. And the patients will come back and say, well, they didn't listen to me. They didn't take the time. The team was really busy. So they didn't really fully evaluate me. So being a hospitalist in this case was truly a blessing to the hospital and the patients because we're not having to rush between clinic and hospital patients. We actually have the opportunity to focus in and really take the time to listen to patients, evaluate them, and manage them in a very timely fashion.